Hello, everyone. This is Wayne Bennett with ECRM and RangeMe. I'm happy to be joined today by Jake White, who is the VP of Consumer Health and Wellness at CVS Health. Jake, great to see you again, and very much appreciate you doing this with us today.
Yeah, absolutely, Wayne. It's great to connect.
So it's real exciting to have a leader such as yourself, Jake, here with us today. And I know there's a series of questions we want to get into right away. So let's begin. I know omni-channel strategy has been very important to CVS Health, and from a health lens. Well, let's back up for a minute. Tell us what you do at CVS.
Thanks. Yeah, I'm the Vice President of Consumer Health and Wellness, as well as supplemental benefits for CVS.
Okay. So, Jake, again, tell us a little bit about the CVS journey and becoming a much more digitally centric retailer, and how are you succeeding in the omni-channel strategy as it relates to delivering health and wellness products and services?
Yeah, it's a great question and one that's really on the top of our mind every day. Our leaders, Michelle and Musab, have come from really digital backgrounds, so I think it's really in the DNA of the people that are at the head of the business, as well as myself. I've got a lot of digital experience prior to CVS. Um, and so if we take a step back, we want to win on, or we win on convenience, and we aspire to be an easy place to shop. And omnichannel is really a major way that we do that. So our digital experiences have a really big impact on our in-store shoppers. We have about 3 times the number of customers who use our app or site before they go into the store than actually even end up transacting online. And so they're really using that to prepare for shopping. We provide a great resource to do that. We're also leaning into new delivery and pickup options. Our loyalty program members, many of our loyalty program members already get free shipping, and we'll be launching new benefits in 2024. Customers love buy online, pick up in store. The NPS, as well as customer repeat purchase rates, are improving strongly in 2023. And our digital experiences are really becoming a lot more personalized. So those include better recommendations, search enhancements, and personalized deals and awareness around localized health events.
That's great, Jake. So it sounds like there's been a lot of movement and moving along the development curve and really embracing the omni-channel effort. That's great. So
Right.
beyond the innovations you're doing there, what other CVS Health innovations are you guys making around health, healthcare assortment, and healthcare service? Tell us a little bit about that.
Yeah, it's a great question. And if you think about what our CEO Karen Lynch has said, we more than any other retailer are becoming the front door to healthcare in America. So it's a lofty goal, and that makes us not just any old retailer when it comes to health and wellness. We're focused on innovation and authority around the consumerization of health in America and the broader healthcare industry landscape in total. So, from a consumer perspective, we're trying to make healthcare more accessible and use our authority to do that in the space. I'd highlight our Here for Her campaign around women's health, which, by the way, was originally an idea that was sparked with one of our most strategic suppliers in the fem care and baby categories, which shows us that when we partner together, we can go further, faster with authority. We're making bold moves to support women, from taking on the pink tax. The classic example of this is when men's and women's razors that are just pink versus blue are priced differently at retail. And I'd use this opportunity to actually call on my supplier partners to make sure that your costs are the same. Just because something has 3 more micrograms of vitamin B12 doesn't mean it should cost $1 more because it's also in a pink package. Doing this actually only raises the health cost disparities, which is a huge problem in America.
Mm-hmm.
We're working to eliminate the tax on menstrual products. Can you believe that in 13 states, period products are taxed as luxury items?
Wow.
So CVS is actually paying the tax on behalf of consumers in relevant states, and we're partnering with Period Law and Period.org to remove that tax.
Mm-hmm.
We also reduced the price of our store brand period products by 25% to drive access. And this has driven great results for us as well from a business perspective. We have 25% awareness for the first 6 months, which is comparable to our tobacco exit. Trips in the fem care category, inclusive of menstrual products, are up 4 times over competition. And we've got 41 million impressions. And so we're becoming an authority on women's health by these actions.
Jake, thank you for sharing those Did you have one more?
Yeah, I actually have one more.
No, this is great.
Going on in innovation.
No, go. There's a lot going on. Sure.
Yeah. So in second, from a total healthcare industry perspective, we're working to implement supplemental benefits programs across a wide range of payers.
Yes.
This healthcare service really helps our payer partners differentiate their health plans and makes their members more loyal. And CVS actually makes it really easy to use those benefits with us. And so our customers already trust us for healthcare. And so we're really a natural leader in this supplemental benefits space.
Yeah, that's great, Jake. I mean, there's a lot going on. You guys certainly earn and respect and command the leadership in the healthcare space, and some of the things you just shared are certainly indicative of that. So, Jake, in terms of post-COVID, I hate talking about COVID because COVID is fortunately behind us, but so with that said, in a new consumer mindset post-COVID. What are you seeing out there? What trends are you seeing? How did COVID change consumer behavior? What's present today in the minds of consumers as it relates to their health regimen and health care? And what are they thinking about?
Yeah, it's a great question. And we're seeing really COVID actually resurge in some ways as well.
True.
And I think and recently, I think it shows sort of the the endemic nature of the virus at this point. And it's still part of people's, planning and has really changed their behavior, like you said. So I think COVID made people realize really 3 things. 1, they got to take their health really seriously. 2, they can easily understand, or they should expect to be able to easily understand their personal health status. And they increasingly recognize the efficacy of OTC products in managing their health and wellness. So there's a ton to be excited about in consumer health and wellness, and CVS is a destination in the space. We're seeing incredible innovations all over the market, from pharmacy to new OTC categories like hearing aids, naloxone or Narcan, and OTC birth control. And so we're making these products more accessible to Americans. Second, we're becoming America's testing destination for OTCs. Consumers now understand really the power of the OTC test and expect to be able to understand their health status more easily. So whether that's from a vitamin deficiency test or an STI or COVID, we've launched a line of CVS Health testing products in this space, and we expect a lot more innovations to come. Mm-hmm. And finally, consumers are, like I said, treating their symptoms more aggressively, and they're preparing for healthy living more diligently as well. And so I think the last several years have led people to try new items, really realizing how effective those OTC products can be in managing their symptoms. And then at the same time, expanding how they think about immunity, hydration, and general wellness preparedness.
Yeah, absolutely. And a lot of the things that you've discussed are some, things that I even consume in my, regimen for better health. So
me too.
Exactly. Right. So you're right there on point. Yep. Yeah. So Jake, CVS Health is a formidable retailer. You've got thousands and thousands of stores, now amplified by a growing, formidable digital platform. So it's a whole total shelf. Can you share for our audience, why should CVS Health be a primary launch partner for new products? Tell me why. Why do I launch with CVS first?
Yeah, it's a great question. And, I'll be honest, I don't think that we're the right partner for every single brand out there, but
okay.
We do aspire to have 2 times fair share on any major launch that we undertake. And so when we get behind a brand, we really are thoughtful to make sure that we're capturing the customer and we're setting that brand up to win. And so I would say to all the brands out there, listen to what we're saying in terms of product improvements and launch planning, how to make yourself stand out. Mm-hmm. And we have awesome capabilities to drive success as well, from our loyalty programs, which boast 70 million members, to our more limited store rollout options to sort of test into scale with a
Yeah.
major retailer like CVS. And so, like I said, we're building our health and wellness authority, and new brands are really a critical way that we're engaging new consumers on their healthcare journey. So we're super thoughtful about that.
Yeah, that's great. Thank you, Jake, for that. From your seat and, obviously the connectivity to your team, there's a lot of engagement you have with new and emerging suppliers. And for our audience, Jake, what are the three top recommendations you can offer up to these suppliers that have great innovation, unique products, looking to break through? What do they need to bring? How do they need to prepare? What's important?
Absolutely. It's a great question. I think first, we see a lot of brands out there. And so you're competing in a vast space. So tell the story about why you are different. Everybody knows that I love Liquid IV, at least around CVS. And, as an athlete, not only does their message really resonate with me, but it seems to also be true. The product just works really incredibly well for me. So develop that unique and innovative product. And second, the details really matter, from packaging to marketing. Really make sure that your product stands out and works well in a busy retail environment from an operational perspective, but also from a consumer perspective. And make sure that you're able to articulate the specifics to your buyer on why your product will or is already a success. So think about the bottles, the texture, flavor profiles from innovative brands. I'll throw out the example of Ollie, great brand in the vitamin space, or true innovations. So like our small supplier of the year in Frida, you could look at their product line, and they're just really true innovations. So as you're thinking about your go-to-market preparations, really ask yourself those tough questions on, have I done everything that I can along those kind of lines? So, and third, really build relationships over time. Most brands don't, have a huge end cap launch or take over an aisle to start with. They prove themselves by, developing awareness, a really loyal customer following. This takes smart marketing, response to customer and buyer feedback on the product, and sometimes fortuitous timing. So I think about a brand like Honey Pot in our women's health business. We went from a 10-store test to end caps and wide-ranging distribution and items in multiple categories over a few years. And that's really a great success story for us. And
Jake, I believe you call that test and learn.
That's right. Absolutely.
Yeah. Thank you for that, Jake. And I know that's a lot of wisdom and years of experience and feedback that you get from your merchants. And thank you for sharing that. Very important. So, Jake, I know that over the years, next year, ECRM is celebrating its 30th anniversary. We're very excited by that. Thank you. You guys, as an organization, have leaned in probably since the beginning of that time. And I know currently your team does use RangeMe, and we appreciate that. But I'm curious if you could just share maybe some insight to the audience as to how your team does use ECRM throughout the year, and how that adds value into your process.
Yeah, absolutely. ECRM and RangeMe are business critical for CVS. End of story. So, thanks for all the work that you do for us. You've been an incredible partner, and so has your team. Our buyers are incredibly busy running the business, both operationally and strategically. So ECRM and RangeMe really bring together everything under one roof or platform. And through our partnership, you all really know what we're looking for and help us let the cream rise to the top.
Yeah.
So we leave ECRMs with renewed energy and focus on our customer, educated about innovations that are being brought to market. And with RangeMe, we have an incredible digital resource that makes it quick and easy to find brands in areas that we're looking to grow. So, we are very close working partners along those lines, and it's been a great ride with you all.
Jake, I really appreciate that. And, the mission, the purpose of the company, which, has been for much longer than I've been here, really resonates in today's environment. where organizations, your organization, our organizations, organizations in general are doing more with less. And, that is really the premise of our company. And, we appreciate the partnership and the recognition of the work that we do. So thank you for that. Jake, this has been a great discussion. I know you're real busy doing all these wonderful things to change the curve of healthcare, in America. And so I appreciate the time with you today and the partnership and the connectivity that we have. Is there anything you'd like to just close with?
No, I mean, I think it's an exciting time to be in consumer health and wellness, and CVS is a super focused on our customer in innovation. So we'd love to engage with continue with you and all the new brands that are helping us do that.
Yeah, Jake, thank you. I really do appreciate your time. Thank you. And for the supplier community out there, Jake White, VP Consumer Health and Wellness at CVS. His team is ready to connect. Bring your story, bring your purpose, bring your mission, bring your innovation, and most importantly, put it in context of what's important to CVS, and you must visit their stores. So I leave you with that. Jake, thank you so much for your time, and keep rocking.
Thanks, Wayne. Appreciate it.
Okay.
Take care.
Yep.